This is our closing panel, and I'd like to invite Peter Long. So Peter is a member of the PCC board, and he's EVP Strategy and Health Solutions at Blue Shield of California. At Blue Shield of California, they have 4.5 million members. They are a nonprofit, and they serve the state's commercial, individual, and government markets. Long leads, or I should say Peter leads collaboration with health care providers, community leaders, and other stakeholders to design innovative clinical and community programs and healthcare delivery and payment systems that provide all Californians access to high-performing care. You know, if you have been paying attention to the news, there's a lot going on at Blue Shield. They've been real champions of primary care, which is why we invited Peter to join the PCC board. And they've also been trying a lot of other innovative ways to get more value for their members. Peter's going to bring the mayor up and introduce her, and we're going to have a wonderful conversation. Thank you.
Perfect. Thanks, Ann. Good afternoon, everyone. So this is the rallying part. We're going to rally you to a strong finish, and I think Mayor Holliday Ingraham is going to be a treat. No, we have a very long introduction for you, Mayor, so you just might as well take her. She has a very impressive background, and I want to do it justice. So we've heard from policymakers, we've heard about solutions, we've heard about our personal stories. The conversation has been within us. As the mayor said, the conversation has been among the choir, and it's a great choir, and we have a really strong voice. Sometimes it's important to hear people in the world who interact with the healthcare system, people who have influence and have authority but don't come from our world and don't live in our world every day. So it's an incredible gift I think we have today to hear Mayor Holliday Ingraham, her perspective. She has an incredible story that intersects with healthcare, but it's mostly around people and leadership and vision. And I think it's going to be super instructive for all of us as we think about how do we advance primary care, how do we make it work for folks who don't live it and breathe it every single day. All right, now here's the big introduction for the mayor, and it's, as I said, prepare yourself. She's an incredibly impressive human. So I'd like to introduce Mayor Deana Holliday Ingraham. She is the 34th mayor of East Point, Georgia. She is a champion public servant, wife, mother, advocate who is dedicated to public service. Her parents taught her to think outside the box and live to improve the lives of others, and they did a great job. They really did a great job. I love this quote that she shares. She believes that service is the rent we pay for our room here on earth. Think about that. Service is the rent we pay for our room here on earth. So the smart residents of East Point, Georgia, re-elected Mayor Holliday Ingraham to serve a second term 2 years ago. So she's in the middle of her second term. She's been at this for a while, and she's made some incredible progress that she's going to share with us today. She's championed the East Point being designated as a welcoming city, an AARP network of age-friendly states and communities, and livable wages for city employees. She led the creation of the Healthy Point Initiative to increase healthy lifestyle choices for East Point residents, among other programs in the community that she serves. And she's well educated. She received her bachelor's degree from Florida A&M University in Business Administration, her master's of science from Nova Southeastern University, and a Juris Doctorate from right here at Howard University Law School here in DC. She has twice been named one of Atlanta's top 100 Black women of influence, and she serves on the National League of Cities, the National Black Caucus of local elected officials, WellStar Atlanta Medical Regional Center, and that's going to be interesting. We'll come back to that one in a minute. So I'd like you to join me in welcoming Deana Holliday Ingraham, the mayor of East Point.
Thank you.
Thank you, Doctor. Okay. All right, we're out of time, Mayor.
We're out of time. You did it all. You took care of everything. Thank you. Thank you.
Welcome. Thank you for joining us, and thank you for sharing your story.
It's a pleasure to be here.
So let's start right at the top. You said you found religion around primary care. It's a great way to start. So for among this group, you found religion. What were the circumstances that led to that, finding religion for you?
So, you know, Peter, in order to find religion, generally you have like an evangelist or preacher or something like that, right? So I have to give it up to Megan Douglas, who's in the room from Morehouse School of Medicine, and I think she just walked out as I was giving her a shout out. Oh, there she is right there. That's my evangelist. That's my
Right.
preacher, minister, and all of that, right, around all things health. And also let me say thank you to PCC for giving me this opportunity to be here. So my journey, sometimes you choose to change churches, right, and find your new religion. I kind of ended up being the mayor in the city at a time where the ER and hospital in our city closed. And it was the only ER room and hospital in South Fulton County for the 8 cities that are south of Atlanta. And so, didn't really get a heads up. A couple weeks, and I served on the regional advisory board for the hospital, but yeah, that didn't give me any notice either. And so, when we find ourselves in that situation, of course, who does the media call? And they want me to have all the answers, right? So, when that happened, I realized as I started researching and looking into it that we were viewing a very familiar movie, and it was actually the trilogy, right? Because before AMC, it was Tenet, and before Tenet, it was South Fulton Medical Center. So it was the same movie, same plot, same storyline, and same ending, closure. And so it wasn't necessarily the name on the building or what was happening. It was just crystal clear that the model doesn't work. The data that they had for the hospital showed that over 80%, over 90% of the people who showed up didn't need emergency care. So we're paying to provide primary care at a very high cost of emergency care. And then people who are insured were choosing not to go there, right? So if you sell pencils and nobody buys them, what's gonna happen? You're gonna go out of business for selling pencils. So even though that was the state of affairs in my life in elected politics, I like to convince myself I'm different, but people sensationalize and use that as a moment to sensationalize I care about healthcare. Open up the hospital. We need a hospital. We gotta have a hospital. And they never go nearby or to the hospital or refer people to the hospital. But it sounds good, right? And the reality of it is we don't really want people in ER or hospitals. We want people to be well, right? So we really need people to have a primary care home. And so as I was processing through that, that was in May of 2022. I then had a personal experience by having a resident that I know tell me that they had a procedure. So if you think about this hospital, there was another one in Atlanta. They share the same license and CON, but they're in 2 different locations. The one in Atlanta has the trauma center and a lot more hospital services. They ended up closing too. And so right before that closure, an East Point resident went there for a medical procedure. It was one of the few people, last few people to have that procedure. 6 days later, that hospital's now closed, right? There's a situation, they have to go to the ER. ER and hospitals in East Point's closed. The one where the resident had the surgery is closed. So now the doctor had to find a place or find someone who had privileges at another hospital to have the patient to go there. Patient goes there and it's like 12:40 p.m. It's kind of still COVID, so her family, her husband couldn't wait with her. She sat, she waited for hours, feeling about like she was gonna pass out at times, right? Like very nauseated. People would kind of come talk, or you move you to this station and then you play musical chairs. While she was sitting there, she heard a mother say, "I have to leave now because the person who's taking care of my kids has to go to work. And if they go to work, my kid is gonna be home alone." And the young lady had been there already at least 8 hours plus. This resident goes to another, get blood work or whatever, come back. So now they've switched chairs because it's musical chairs, right? There's 60 people and they in and out, back and forth. And when she comes back, she says, the person sitting next to her, they're doing registration with the mobile thing, and they asked him where was he from. East Point. Lives in East Point, uninsured, can't get services in East Point, has had to make him find a way to get to Atlanta. And this goes on, and so then it's about 9 hours in, and she hears the person, the nurse, head nurse on duty, who's clearly making the decision. The decision maker, you know, when you sit in the ER, you kind of look and you're like, who's calling shots? And they were about to end their shift. So she said, immediately jets over there, and she said she told the lady, look, I mean, is there anything that you can do to help me get in a room? Like, she said, oh, I thought you had a bed. The lady was like, no, I've been here waiting. She said, well, I'll definitely make sure you get one before I leave. So, 10 o'clock, this East Point resident gets into a ER bed and has waited for almost 10 hours in her affliction with others who were afflicted with whatever it is to just get into a bed. And that person was me. And so the next day, I'm in the room and the Wellstar government affairs person calls. Like, how you doing? And I was like, I'm fine. You know, I tell my story. He's like, well, is it okay if I tell the government affairs person for the hospital that you're here? And I'm like, yes, if I had told you that yesterday, maybe I could have saved myself 10 hours. And then I started thinking about it because I'm very spiritual. And I'm like, so why did this happen to me, right? I should have been in a bed. Like, I should have been able to come in and go home last night. And I realized it was meant for me to hear and see and experience what others experience because they don't have primary care. So a lot of people that were there, I mean, you're not talking about serious acute situations. They just didn't have a primary care home, and those situations became acute because they haven't been treated. And so in the midst of all of that, I am now a primary care champion, because I didn't even understand the role that primary care plays, right? And when somebody they would just ask how many people have a primary care physician, I was proud to be able to raise my hand. I just secured them last month. But I was with a Wellstar doctor who, with all these changes, left, and I hadn't really secured my next space. And it's actually a federally qualified health center in East Point, Southside Medical Center, and they provide high quality care. So I am all in, and I know it's a long way, but I had to tell you about my conversion and how I got religion, so.
Thank you. So let's telescope up a little bit about, so after the experience of the closure, as the mayor, what was your sense of how well your community is served from a health perspective? And then what are you doing about it? So you share with us your personal story and your conversion, but how about your view as a mayor? How well do you think your community is being served? And share with us some of the things you're doing about it.
So I think when I hear the data that over 90% of the people who are showing up at ER need primary care, and they don't have a primary care home, we weren't doing well. Right? The reality of it is that that's something that we should be able to help connect them to. The percentage of people who are insured in East Point, I think it is around 83%. So if 83% of the people in East Point have insurance, how is it that a medical center, a hospital, ER, that provides other services closes because people aren't choosing to use that facility, right? We also had a situation, so when the ER and hospital ended, they converted it to an urgent care. And so there was some press around it. I think they may have even sent out letters, but people were still showing up with emergency issues at an urgent care that could not provide support. So people were showing up who had severe chest pains, gunshots, stabbing, where you have to be in the emergency room. So what I mean, the urgent care now calls 911. And when they call 911, who has to show up? East Point Fire Department. So that's a rescue truck with 2 employees, either 2 EMTs or 1 EMT and a paramedic, show up in one of the trucks that is for 911 calls to go here. But we're not an ambulance, so we can't transport. So we show up, we're on site, and then we have to wait for Grady to bring the ambulance. So in May
Grady in Atlanta.
Grady, Atlanta.
Grady
Okay,
Hospital,
I'm
right.
sorry, yeah. I'm sorry, I'm new to all of this, so terminology and names and connections, I'm not trying to intentionally make them, let's say that, disclaimer. So it took them, and from May 2022 to through the end of that year, there were 87 of those calls. And when the East Point Fire Department rescue truck showed up with 2 staff, so I got a truck out of rotation and 2 staff people, they had to wait from around 30 minutes to 2 hours and 40 minutes for the ambulance to come. So that's 2022. 2023, from January to June, it went down to 14 of those calls. The wait time was 8 to 30 minutes. And what our fire chief decided is that if it took longer than 20 minutes, he sent over an air light truck. So like a truck with just one paramedic to wait, but it's still staffing that we could use other places. And so I'm preaching to the choir, as Peter and I were talking, but like if you're waiting that long to get transported to ER with extended wall time that I experienced, we're talking about a whole lot of minutes. And minutes can mean life or death, right? And so that was a chronic state of affairs that we were experiencing because of that. And then also, I realized that the choice principle wasn't working. I call it preferred choice. So like health systems have to choose to provide the necessary equipment, capital, marketing necessary to have services in the city. Then doctors who provide the services that our residents need, I forgot the mic was there. Residents in the surrounding area need have to choose to provide it at that health center in our community. And then what's most important is that people with choice, insured people, choose to go there. Because if it's going to survive and sustain itself, all of those entities, that three-legged, everybody has to choose to do that. And so even though we're going through that and facing those challenging situations, because I have a pulpit or a platform that I can speak from, I tell people, I said to my residents, like, look, it's coming back, but when it comes, I need you to go, right? Like when it comes, it's not gonna just be acute care, it's gonna be an accessible, affordable, high quality, comprehensive care model, and I need you to go. And so because I try not to be intentionally hypocritical. That's why Southside Medical Center is my primary care provider, right? And why I go get services there. My mom, who's 85, she lives with us. She receives services there. So that when I show up and I say go, and they're like, well, Mayor, where do you go? Like, oh, I go up in Buckhead. Like, no, I go there. These are my doctors. They provide high quality care, and I need you to join me. And the other thing, which I'll say to go in detail a little bit later, is that I have residents who have answered that call, but guess what happened when they showed up? It's out of network. So they want to support the healthcare center in our community, but they had to pay more money to do it, right? So those were all of the things we saw, and then our solution stems around, and Morehouse School of Medicine is an invaluable partner for East Point. They applied for over $1.1 million grant from the federal USDA, and they were awarded to advance health equity in East Point. And so through that, we have been able to have a comprehensive, community-oriented, person-centered health system that's built on a strong foundation of primary care. We also partner with the FQHC in our community to fill gaps. And so what AMC South did was actually contract and partner with the FQHC that's next door to help provide and expand their building to provide urgent care in extended hours, like late hours, so that people who are showing up with non-emergency situations could actually get the proper level of care. Morehouse School of Medicine is reopening a primary care clinic in East Point with telemedicine, extended hours, and community health workers. And then I was hoping I'd be able to tell you all more now, but it's still in the works. But we are working on an innovative, people-focused, community-based approach that will actually ensure that we have accessible, affordable, high-quality, comprehensive health care that includes acute care in our community with the FQHC. And so I believe that, you know, there is a need, there is a space for ER in hospitals. No matter how healthy or well you are, there may be a situation where you need to go, and the closer one is to your community, the better. But unfortunately, in this country, we lead with sickness and those models versus wellness. And through my experience, I feel like in this country, we have a health system that lacks care. There's not a healthcare system. There's a health system that lacks care for the people that it's supposed to care for. And then we, these people, the people in this room, in this choir, right, are the ones that have to advocate to change that, to make people focus on people.
Well, it's incredible to think that you took something that was a catastrophe, your own personal experience, and then have turned it into literally building a system from scratch. Mm-hmm. And what's even more remarkable to me is you're a mayor. You're a mayor of a city, right? So you have a lot of other things to do besides rebuild the entire healthcare system. So, and you don't have control over the healthcare system, right? You're the mayor. You're elected. You have control over a lot of things, but not the health. You have control over the firefighters who go out. But yet healthcare is vital, and if hopefully when it's health and care. So what have you learned about working with the healthcare system, or what have you learned about the healthcare system, and then how do you work with it as an elected official in your community?
So to your point that I do a lot, so I'm actually a part-time mayor with full-time expectation and woefully part-time pay. So I actually have a full-time job and a husband and a 13-year-old daughter who plays softball and travel ball, and she's a pitcher. I'm proud softball mom, #softball mom, and all of those things, right? But what I realized is, like most other things, and you know, sometimes I'm like, you do realize you're in politics, but it's political. Healthcare has become extremely too political. We have to be very intentional about stopping politics from creating barriers and getting so that people can get the care that they need. And then I talked about the no care, right? So like knowing these things, I'm very intentional about not politicizing people and people's needs, right? Like I believe healthcare, like housing, it's a fundamental right. Like everybody has the right to be well and to live healthy and to thrive, right? And it is it is something that we should take very serious and like we should hold tight to. But unfortunately, we have people who are elected to serve people, and because they choose to serve themselves, unfortunately, a lot of times people get left out. And so that means that people like me, like you, who are in service fields, like while that's a fundamental right, we have to take on that duty and responsibility to advocate and fight and ensure that we make sure that people get the right services in the right place and at the right time. And so I lead and model the people first, people focused model of a way of doing things. My focus and default position is always people, right? Like, what does it mean? What is it gonna mean for people? Keeping people primary. And I say the things that are often not said. I follow the path less traveled. And I also know that you can do the same thing wrong for 30 years and that doesn't make it right. Like it's still wrong and we need to change it. And I'm a disruptor. So I'm not afraid to be innovative and build the Underground Railroad through like workarounds and making sure that we have effective workarounds that come up with real people-focused solutions for real issues for real people. And that's my North Star. And it's challenging because oftentimes you're in rooms with people who say they care about people and you're like, no, you don't. But if you really want to play, now I will say, look, I also assume goodwill, right? Like maybe it's my role in the room to give you a play, right? Maybe you have other competing interests or other supervisor or things like that. So I'm gonna show up and I'm gonna provide that for you. And then together, we should be able to help really improve the quality of life of people.
Let's build on that. So in healthcare, one of the things, we have a lot of measures, and we do a lot of measurement, but we don't necessarily set goals. So like, what does good look like? So I think it's really impressive particularly around health equity in your community. You've talked about the different residents and the access and the insurance rates are low, right? Almost 20% of the folks are uninsured. So have you set goals for what good care and good health look like in your community? And how do you take that on as the mayor? So part of the play, right, is setting out what success looks like for everyone.
So Megan, again, I keep referring to Megan. Megan helped me understand and realize that 20% of health outcomes is really based on healthcare. Yet that's where we spend a lot of our time. We, not the choir, but you know what I mean when I say we, right? And so we know and we focus on healthcare plus the social determinants of health, right? Like, because in order to really help people and empower and equip people to make their own healthcare decisions and understand how to be well, like there are a number of social determinants of health that we need to deal with. Health equity we've defined as a state in which everyone has a fair and just opportunity to attain their highest level of health, right? So that's our goal. Everyone has a fair and just opportunity to attain the highest level of care. And then what does it look like? What will we see? Residents will have access to health care they need, and residents want to receive care in their community, regardless of whether they are insured or uninsured, and that they'll have access to affordable housing, healthy food, transportation, clean air and water, regardless of income, race, ethnicity, or education. So for us, that's what health equity means, that's what it looks like, and those are our goals, right? And it's a work in progress, but I think we're making some really good gains, and we're empowering our people in our community. We have a community advisory board made up of residents in the community who are leading and helping to lead and work with Morehouse School of Medicine around advancing health equity, because change is only possible and sustainable if the people demand it, right? Every 2 years there are elections. And some people are in office for 4 years or 2 years. That level of change and volatility, like it's hard to build a system. But if the people in the community understand and are empowered and equipped to demand what it is they want to see and advocate for, it doesn't matter who's in office. So,
thank you. So let's talk about your advancing health equity in the city of East Point. So tell us about just a little bit more about that project. It's super exciting. And then what has it revealed? What's been exciting and surprising for you in pulling that work together?
So good segue. So that part of the community advisory board, right? And the Healthy Day 90-day initiative is now year-round. So like year-round, we have health activities to help our community that are free to meet people where they are, right? So like our Healthy Point, and for 90 days, it's intensive. So we provide free exercise classes, and it's holistic, mind, body, and also making sure that mentally we understand, right? So like it's exercise classes include Zumba, yoga, Pilates, walking. So we have a path in our city, so walking the path, as well as box fit and bounce. Have you all heard of bounce classes? So they literally have mini trampolines in the room, and there's like 50 of them, and you're like bouncing and moving, and it's very energetic. They have really great music, but it's very exhausting. But
you're a practitioner, I take it.
I've been a couple times, and then I was on the ground trying to talk to a kid. I'm like, come give me a hug, baby. But the exercise, please, we do cooking demonstrations at City Hall on City Hall steps, because a lot of times you'll give people eggplant and they're like, what am I supposed to do with this, right? We used to do cooking demonstrations at the convenience stores, like meeting people where they are. So we would partner with local farmers, have fresh produce there, celebrity chefs would make a dish, and then the event favor was the ingredients with a recipe card and a whole bunch of resources and health resources in the community. So teaching people how to eat well, and we also, I'm a flexitarian. Sometimes I used to say I'm vegetarian. I really like flexitarian though, because today I might eat meat, tomorrow I might not. But we had healthy movie nights, right? So like the first night it is, we start them off with Food Inc. Y'all seen Food Inc.? Then we go to Forks Over Knives, and then we hit them with What the Health. Because if you watch What the Health for at least 24 hours, you're not going to eat no meat. You might not eat. I'm just saying. I had some rib tips the other day, but for 24 hours, you're not eating meat, right? But it's just to get people to thinking, because it's really mental, right? Like, you do these things, and I want to lose 10 pounds, and then you gain 50. So, and then we also do a 5K run walk, just a lot of intense activities for that 90-day period to build connections, so people get to meet other people and connect around health. We allow people to work out at our rec center for free. And then the goal is that all year round we're providing something monthly for them. And so when we think about like those activities and realizing how important it is to create this culture and climate, one of the things that was most alarming, I think you all may have heard about Stinktown. On July 15th, 1912, East Point City Council required all black people in the city to live immediately adjacent to 3 fertilizer plants or oil plant and a chemical plant. It smelled so bad they called it Stinktown. And so black people in the city, if you didn't live there, you had to leave the city. And so that level of environmental injustice, it was really informative to me. But when we started this work, and I'm a part of the NO's National League of Cities Mayors Institute, we had this data meeting, and they showed us data for East Point, specifically for East Point. We're also a part of the City Health Dashboard. And there's this one data piece on life expectancy. And there's one area of the city that has the lowest. There's only one area in the city that has the lowest life expectancy. It's like less than 70 years. And there's no other area in the city with the same color. And guess what area of the city it is? Stinktown. It's now East Washington, and it went through, of course, a renaissance and was able to, but the people who live there have the lowest life expectancy in the city. So a decision that was made over 111 years ago, a century later, is still having negative impacts on the community. So I said, look, that's not about to happen. 100 years from now, when people look back on this time of leadership, they're gonna be like, this is when it changed, right? Like, we are experiencing, positive impacts, and it started here. But those are that's how critical the things are that we have the ability to make decisions on right now. And then we also included, for the first time ever, health equity within our comprehensive plan. And equity is in there at least 48 times, and health equity is actually a community goal. And we actually have a full equity statement. And we created the Office of Equity, Inclusion, and Empowerment to build infrastructure internally, right? Because it's okay today, but we need to make sure that we're able to sustain it, and we're building the capacity of people inside the organization as well as in the community.
It's incredible. Health is a verb, right? You're living
Yes.
health,
Yes.
living community, living health. I mean, just what a model and example. All right, so I'm going to push my luck here. You've been incredibly generous by sharing your story, sharing this. What we want is the blueprint. So if you could help us, think through. So we've been, you were in the room, you heard us all working on our story, our origin stories. What are we going to do next Tuesday? From your perspective as mayor, you've clearly been living this and working it. What are the elements of that blueprint that we should all take away when we're building primary care, when we're looking at this is what it looks like when it's great, this is what it looks like when it works? What's in that for you?
So what you're doing plus, because I'm preaching to the choir, so I know you all are already doing things, but I would say center the community, so ensure that they are being heard and that there's guidance and feedback, that their guidance and feedback is being acted on. Leverage community assets. Every community has strengths, everywhere. I don't care what it looks like. There's strengths in the community to be leveraged through its residents and community organizations. Again, continue to address the social determinants of health, and then advocate for in-network expansion for primary care. So every person, when you look at a person, every person should be able to choose their primary care provider, whether they have insurance or not, whether it's private, Medicaid, Medicare, or even uninsured. And so advocating to increase the use and capacity of FQHCs, as well as making primary care the focal point for healthcare funding, not the upside down model that we have. And so also I would say that, depoliticize healthcare. as much as you can. So I'm grateful to be here. I like to go places when I'm not around elected officials. I don't even say it's a secret. Like right now there's a conference going on in Atlanta where elected officials from across the country are here, and I was supposed to literally be speaking there at the same time as this, and when I got this opportunity, I was like, yeah, I'm not gonna be able to make it. I'm gonna go talk with people and be around like-minded people. So elected officials may be helpful, but they're not essential. And that's may with a capital M, capital A, capital Y. Because if it's an elected official who's not aligned with your keeping people primary goal, an elected official that does not put people first and is not people focused, don't even waste your time. Like honestly, like you could be respectful about it, but don't waste your time. Because that's time that you could be really spending, advocating, building that underground railroad, right? Creating effective workarounds to ensure that people get accessible, affordable, high quality, comprehensive health care. And it's a dual track, so I'm not saying that policy is not needed, policy and funding. But in addition to that, also be willing to be a disruptor. The model doesn't work. It is not going to adjust to the things that we need it to do. It won't be that model, right? Insanity is doing the same thing, expecting a different result. Be willing to be a disruptor for good sake. And then I would say encourage each other. Like honestly. Like look to the person to your left and ask them, do you believe? Look to the person to the right. Ask them, do you believe? Because if you believe, our beliefs change and turn to knowing. And once you know something, you'll take action. You'll be confident. You'll be willing to go do it. A lot of people say a lot of things about me. Some of it, they say I'm crazy. I'm not crazy, I'm courageous. And it's actually a compliment, right? Because that means that I'm saying something that you want me to believe is crazy, but I know it's not, right? And so Margaret Mead said, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. So to that end, I am absolutely committed to doing all that I can to partner with each of you to grow the movement, to do the work, to focus on impact and continue being champions who keep people primary and build trust for better health. So thank you so much.
I know I speak for all of us. Thank you for being that person who is changing the world. And thank you for showing us what that looks like. That is the best gift ever.
Thank you.
What a way. That is, if we're not rallied now, folks, I don't know what we can do.